My name is Stephanie Callaway, and I'm a student at Maryville University. I'm in the program Nurse Practitioner, Adult Gerontology. Current course is Nurse 612 Advanced Assessment, and this is my 5-minute assessment video. Okay, great.
Okay.
Hi there, I'm Stephanie. I'm the nurse practitioner today.
Hi. Very nice to
Nice
meet
to
you.
meet
I'm
you.
Joshua.
So you're volunteering right now. And so I just want to ask you some questions. These are just some basic questions. The more honest you are with me, the better I can actually evaluate you and your health. So what brings you in today?
I just came in for a wellness check. I'm just turned 32 a couple months ago and thought that getting a yearly checkup is probably a good idea now.
Okay, great. So I'm going to ask you some past medical history, your personal past medical history. So have you had any past medical history that you've been diagnosed with? This includes allergies, could be allergies to food, medications, animals, pets.
I'm allergic to 2 medications that I'm aware of.
Okay.
That's erythromycin and amoxicillin.
Okay.
As far as food allergies, I have none. At least, up until now, I haven't had any trouble. I've got a small allergy to cats. Dogs I'm good with. And almost everything outside I'm allergic to.
Okay, very good. Any past medical history diagnosis that the doctor, you've actually gone to see a physician or a nurse practitioner where they have diagnosed you with a past medical history? I'm sorry, a diagnosis.
As far as like what, bronchitis or something like that?
Mm-hmm. Asthma would be one.
I was diagnosed with asthma when I was younger. I'm pretty active now. It's not really something that's very prevalent. It doesn't really affect me any.
Okay. How about any injuries?
No major injuries.
Okay.
I mean, just childhood stitches here and there, but nothing. No broken bones.
Okay.
No major joint injuries, nothing like that. A sprained wrist when I was in high school, but I think that's about the worst that I've had.
Okay, very good.
Unfortunate.
Surgical history. Have you ever had surgery?
I've had tubes, I believe 3 times when I was a kid.
In your ears?
In my ears, yes.
Both sides or one
Both
side?
sides.
Both sides.
Yes. I had my tonsils taken out when I was 7 or 8.
Okay.
What else? I had surgery on my leg when I was 12.
I see that your right leg or left
Yeah,
leg?
it was my right leg. It was a fatty tumor is what it turned out to be. They thought it was a big blood clot.
Okay. Related to your surgical history, did you have any reactions to the anesthesia?
The times both of those times when I went under, I got sick afterwards, but I think that's a normal side
It can
effect.
be. Mhm.
Yeah.
Okay. What medications are you currently taking? And this includes over-the-counter medications, any herbal supplements that you take.
I take a multivitamin, like a gummy
Mhm.
multivitamin every day. Ibuprofen when it's needed, Tylenol when it's needed, same with that. I use Flonase for my allergies every morning. And on occasion, which has been pretty rare, Sudafed.
Okay, very good. Now we're going to kind of go into your family history. And so if you don't know, that's okay. Just tell me as much as you do know.
Yeah.
So are you an only child? Do you have any brothers and sisters?
I have 2 brothers.
Okay.
I'm the oldest.
Okay.
Yeah.
And tell me about your middle brother. Does he have any medical history, any diagnosed illness?
No, not that I'm aware.
Okay. And how about your youngest brother?
He had appendicitis when he was 18, 19.
Okay.
Other than that, I believe that he pretty healthy.
Okay. And how about your father?
Recently he was diagnosed as pre-diabetic. He's a meat and potatoes type of guy, so he neglected his veggies.
Okay.
But he's got back troubles, knee trouble. That's mostly due to his career choices, just real hard on his body. He had prostate cancer about 2 years ago. Successfully removed his prostate, cancer-free. good and mostly healthy now.
Okay. And how about your mother?
My mother, she's had a hysterectomy.
Okay.
She had brain surgery.
And why did she have brain surgery?
She had pressure on one of the nerves, and it was causing facial spasms.
Mm-hmm.
And they went in there to kind of move things around ever so slightly to relieve the pressure on that nerve.
Okay.
I think that's all.
A little bit further into it, I'm gonna ask about your father's parents, both paternal grandfather and grandmother.
Okay.
So let's start with the grandfather.
Just his medical
Yeah,
history?
just what you're aware of.
He had prostate cancer.
Okay.
That was a while ago. He's cancer-free now. Back surgery, neck surgery, the usual wear and tear when you get old.
Okay.
I don't believe there's anything else as far as he goes. My grandmother, she had breast cancer. She had a double mastectomy, and that was a while ago as well. She's been cancer-free for quite some time. Right now, things have kind of gone for the worst with her. She's got Alzheimer's disease.
Alzheimer's disease, yes.
Yeah.
And then tell me about your mother's father and mother.
I don't know a whole lot about either one of them. My
Okay.
mother's mom died when she was 16. My grandfather, I was never really around him much.
Your maternal grandmother, did she pass away from trauma, injury, or
A car accident.
car accident?
And my grandfather, I'm pretty sure he had a heart attack.
Okay. Okay, so now this is when I need you to be honest with me. This is your social history.
Okay.
So again, we're going to talk about some things that people aren't as open to talk about. And we'll start off with, are you a smoker?
No.
Have you ever smoked?
Yeah, when I was in high school.
And
I think I smoked a total of 1 pack.
okay.
Yeah.
How about a drinker? Do you consume alcohol?
Yes, I
beverages? Okay, and how many would you say per week?
Per week, I don't know, I would say 5 to 10 per week. You know, if I have 2 beers a night, maybe, probably.
Are you typically looking at beer or are you looking at hard alcohol?
Typically beer or wine.
Yeah.
Hard alcohol, not very, very common.
Okay, and how about any illicit drug use? This encompasses marijuana, cocaine, heroin, illegal drugs.
None of those.
Okay.
Ever.
And your eating habits, do you usually get a good variety, or are you typically a meat and potatoes like your father?
I try to have a pretty good variety. Of course, I do like my meat and potatoes.
Okay.
I definitely don't eat as many vegetables as I should,
Right.
but I do eat vegetables, yeah.
And then activity level?
I like to think I'm pretty active. My job is a physical labor type of work.
And what is your occupation?
I'm a sheet metal worker.
Okay.
Yeah. And then I try to be active, exercise, work out at least 3 times a week, usually more.
Okay. And is that, going along those lines, your sheet metal working, are you immunized? Do you get your flu vaccine and?
I have never had a flu shot that I remember.
No flu vaccines. Okay. And then other dental work, do you go get your teeth cleaned regularly?
I try to, yeah.
Okay, very good. As far as you know, tetanus up to date?
Yes, I believe I had my last tetanus shot in 2008.
Oh.
So I've got a couple years left, I think.
Okay, this all sounds great. Thank you so much.
All right.
Do you have any questions for me?
I don't believe so.
Very good. All right.
Thank you.
Thank you.
Appreciate it.